Poisonings are a fairly common thing that happen in children, largely because children are very curious. They tend to put a lot of things in their mouth. They see something on the floor and they are very interested in it. The majority of poisonings actually happen in children under the age of 6. So it's very important that with young children we try to prevent those poisonings from happening in the first place. Some of our most common poisonings that result in admission are basically because of medications that children get into that they're not supposed to, whether it be the cough and cold preparations or, grandma's heart medications, blood pressure medications, which can be very dangerous. However, outside of the hospital, the most common poisonings really are household products. So it's the cosmetics, it's other medications that are at the home, chemicals that we have underneath our sink. It's very important that we kind of arrange our house in such a way that children are not going to get into it. One of the things I commonly tell parents is to get down on their hands and their knees, kind of get at the kids' eye level and see what they see. So if a plant is easily accessible, or you can see the pills underneath the couch, it's really, it's important to actually pick those up and get things out of the way of children. All medications should be kept up high, or especially maybe even in a locked box so that children can't get into it. We've had children actually climb up to the counter and go on top of the refrigerator to grab things off. So having them in a locked place is very important. Another thing to remember is many times when we have a liquid or a chemical that is getting low, we tend to put it into a different container. It's very important that you leave it in the original container so that we know what it is. We don't want a child to see it in a water bottle and then drink it and then find out later that it was something that could cause them harm. Poison Center data actually tells us that over 2 million people get into poisonings a year, with by far in the children under the age of 6. So we know that it's going to happen. What you need to do if your child should get into a poison or get into something that they're not supposed to, the first and foremost thing you should do is call your local poison control center. That number is a national number, 1-800-222-1222, works throughout the country. And so call that number first before you do anything. In the past, we've actually had syrup of ipecac that available to parents to use. That is no longer recommended by poison control centers or the American Academy of Pediatrics. So all of that should actually be discarded and not used at all. And then once you call the Poison Center, though, they'll instruct you what should be done, if you can stay home, or even if you have to go to the emergency room for better care.